All right, we are back, everybody, on Open Line on this Thursday night. Rhori Johnston with you here in the chair, and Dr. Stephen Patrick, kind enough to join us from Vanderbilt Children's Hospital to talk about this latest poll. So let's dig a little deeper. Actually, we'll go back to the top 5 concerns. We got through 3. We know number 4 now is the top 5 concerns that parents have about their kids getting sick from COVID. Obviously, you know, that is a big concern. And again, as we look at this list, a lot of this, you know, is you see the pandemic kind of painted all over this. I mean, there's so many concerns that everyone has, not just getting COVID and getting sick, but as you see, disruptions, there's mental health, there's cyberbullying, overall education and school quality, which we know has suffered. So everything's kind of woven in here. It should be interesting, Doctor. I mean, I'm knocking on wood here and hoping that 2022, we're going to really finally come out of this. More people vaccinated, more people maybe with immunity, and we can get back to some sort of normal life overall. Again, fingers crossed, because I understand that there are variants out there. But it'll be interesting to see in a couple of years, and I hope to have you back maybe each year as this poll comes out, but it really will be interesting to see post-pandemic what this list looks like. I'm sure some of them will be similar, but obviously, hopefully, getting sick from COVID won't be on the list. But
yeah, we hope so.
But it is still there. What are some of the parents saying about this?
Yeah, I mean, we asked parents what the things they were worried about, and COVID kind of continues to be on that list. We've asked parents about many things related to COVID, including what precautions they think their schools should be doing. Right. In the past, we've also asked about their views about who they trust around COVID, about COVID vaccination. And so, you know, one thing's for sure, parents are worried about COVID, but they're also pretty divided about right. COVID too, and what we should be doing about it.
So, yeah, let me get into this. How are they divided? Now, I hope this doesn't, well, it probably is down to a political debate again as we look at this other graphic here, but is the general, I don't know if you found this in your research, but is the general concern more about policy and whether or not people have a choice, or whether it's mandates? Because if you're concerned, you say you're very concerned about your child getting sick from COVID, and then you maybe go on and answer and say, they're not vaccinated and I choose not to send them to school with a mask. Well, I don't know how to, you know, answer that question, but tell us a little more about these results that we're looking at right here. Nearly, and I'm not sure if you can see what we're looking at. Can you see what we're looking at? Okay, go ahead.
Yeah, so we asked Tennessee parents to release these data yesterday, their thoughts on masks and COVID-19 vaccines in schools for teachers. Right. These data were obtained late fall, again, so they reflect what was happening in November. But, you know, nearly half of schools didn't have a mask mandate in place. It was about 50-50.
Oh, let me just interrupt you real quick. I'm sorry. So, by the way, so this was just after the Delta variant surge that we saw, you know, August, September, into October, but before we saw Omicron, right?
That's right.
Okay, go ahead, Doc, sorry.
Oh, you're fine. So it's about a 50-50 split on what, if their school had a mandate in place. Still about 2/3 of families were sending their kids to school with a mask. The interesting thing is we asked parents if they thought their teachers should be masked or vaccinated. And again, about 50% thought teachers should wear a mask. About 40% thought teachers should be vaccinated.
Right,
you know, I think at this point in the pandemic, you know, the question of mandates and the role of government for sure is influencing results. We see that consistently. And I think in some ways it's become a proxy for those things. We also do see substantial differences by region and by race as well when it comes to these questions too, which we can certainly talk about.
Okay. Were you surprised by any of these? And I'm looking at the over 2/3. So let's say it doesn't matter whether let's say that there's a choice. You have a choice to wear a mask. There's not a mandate at a school. Like you said, we don't know the current numbers there, but this was before the legislature took some action. But over 2/3 of parents, you said, choose to send their children to school wearing a mask, or whether it's mandatory or not. I don't know how that's broken down, but that's a pretty decent number. I mean, that's a higher number than our child vaccination rate right now, right?
Yeah, it is very much so. So we're for kids that are less than 12, we're about 20% or so. So
20%.
Yeah, I mean it's certainly higher than that. And so I think we definitely have some work to go in talking about the vaccine. But I do think it's interesting to think through. Like, if we look at the American Academy of Pediatric guidelines, they are guidelines. They are not certainly, this is what we optimally would do would be that adults are vaccinated that are around kids, and that everyone wear a mask that are around kids. For me, it's still interesting that parents don't think that most parents, about 50-50, are split on even just masking of teachers and staff.
Right, 54%. Now, before we get any further, if you could, because you're a specialist, where are we right now with vaccine availability for children, age groups, and who can and can't be vaccinated right now? Because I know that's changed over time. Older than 5.
Yeah, older than 5.
Okay.
And we might be getting vaccines for kids a little bit younger too.
Okay.
The doses for younger kids are a little bit less too. That's important to know. So I have kids in 2 different age groups. I've got a teenager and I've got a kid in the younger age group.
Right.
And they've been vaccinated at different times. My teen has now been boosted too. So that is the kind of front line of defense that we have. And it is true, as we see more variants, things are different. One of the conversations that I hear publicly now is that this conversation of, is the vaccine working if people are still getting sick? And it is, absolutely is. We still see far greater numbers of people that are in intensive care units or ventilated or dying who are unvaccinated. The goal of a vaccine isn't perfection. It's to minimize the disease spread.
Well, and if you think about, for years we've heard about the influenza or the flu shot that people, you can get it or not, but I get my flu shot. I choose to get my flu shot every year based on my age and my discussion with my doctor. That's my choice. But I understand that I can still get the flu because it's a best guess scenario on the vaccine for what strain of the flu, but it's still the flu, just with some variations. And I know because I've gotten the flu before without being vaccinated, and I've gotten the flu when I was vaccinated. And for me, it was a big difference. The flu without the vaccine, you're laid up for a week. And then the flu with having the vaccine, the symptoms much less severe, which again is the hope here. And that's what we're seeing now with Omicron. I think from what we're hearing, fewer hospitalizations, fewer deaths, especially among those who are vaccinated, right?
Yeah, especially among vaccinated. I will say this, Omicron is far more infectious. So we're seeing a lot more people infected. Right. And therefore, we're seeing more hospitalizations. We're seeing that peak, including among kids, higher among kids who are not old enough to be vaccinated.
Right. So as a researcher, you have to look at that and understand, because you're right. It's spread very quickly and very fast, right?
Well, right. I think sometimes we have this, so it appears to cause less severe disease, but it's so much more infectious. You get more people that are infected, right? So I think that's true.
So the
other piece that I see, the other population that I see clinically all the time are pregnant women. So pregnant women are at substantial risk of adverse outcomes from getting COVID. They're more likely to die than non-pregnant women, and they have really low rates of vaccination in Tennessee. I've taken care of babies that are born months preterm because their moms got so sick with COVID, they were on heart-lung bypass. And these are young women.
Is that generally just because a woman who's expecting, the immune system is compromised, or it's taking care of two people. What happens there?
Well, there's so many issues that go into it that in terms of what makes women more vulnerable when they're pregnant. I don't know that I know the answer to that. All I know is that the data speak pretty clearly on what, well, and not just that I've seen it, there are, published reports pretty consistently now of the severity of pregnant women in particular. So certainly I've seen it in my clinical practice, but the data speak to that too.
All right, back to the top 5 concerns: disruptions to schooling due to COVID. That's, again, one of those, not surprised to see it. Give us some more specifics on that topic.
Yeah, I mean, listen, like we said before, parents are worried because they've had to deal with their kids being at home. Me too, doing remote learning. And what we've learned from parents is parents don't feel great about remote learning. They worry about the quality of that. We've learned in our polling of parents. So parents worry about the quality of remote learning, but most parents believe they should at least have the option of having remote learning. And so I think part of the messaging here is that, listen, in-person school should be our priority. We should be doing everything to keep kids in person, but no school is worse than virtual school too. So I think this is where that complicated calculus comes into play. Parents have dealt with kids being at home.
And again, you gather the information and you can pass this on to our policy makers, our state leaders, our city leaders, county, school leaders, because we know that there is a divide and there are a lot of teachers who just don't feel safe going back into the classroom. Others are fine with it. Some say, I'll go back and wear a mask. Others say no. It's all over the place. So all you can do is give this data and say, hey, look, we know that children are better off in the classroom, but we obviously want to keep them safe. We want to keep our teachers, all personnel, everybody as safe as possible. So let's sit down and work out a plan. Yeah,
that's right. And keep kids at the middle of it. Like, what is best for our kids? And look, that you're right. That's the role of what we hope the poll will do. And our other work, we do NIH-funded research. This is different. This is about being rapid, understanding what's happening with parents and kids, and putting that information out there to inform the public and policymakers. So this is different than our NIH-funded research because that process moves so slowly, from writing grants to getting papers published. So we do that for sure. The goal of this is really to elevate the conversation around Tennessee children.
When you get everything disseminated, do you do a final published report? And what does that look like? And who do you actively send it out to certain people, or do you just wait for them to ask for it?
No, we definitely are not passive with it. So we send it out to certainly the press, policymakers. On our website, if you go to childpolicy.org/poll, you can see our report from last year, which is about 10 pages comparing like the previous 2 years. We also do webinars. So last year we did a webinar where we had folks from folks in the legislature, other policymakers that attended to learn a little bit about things too, and of course members of the press and public too. So, this doesn't do any good if it's just me and you talking about it. It's important that we sort of get out the word, because look, our goal is to make Tennessee a great place to be a kid, and we can only do that if we talk about the issues they're facing.
Yeah, love that. Good way to kind of wrap up that segment. We got another quick break. Our final segment with Dr. Patrick is coming up. Be right back.